I'll show you the condition of the patient. This is after 3 days after the implant placement. Amadima, Amadi. So there was a single tooth missing, central incisor. So it was periodontally compromised, and I'll show you up the X-ray and a pre-operative photo also. We have placed 2 implants, and we bent it and we welded it, and this is the crown fabricated. Okay, so this is how it fits. Perfect. Slight mismatch in the shade, but it's okay. It looks fine with the patient. How many? So we placed 2 implants, one directly into the nasal floor, which is engaging the nasal floor above the apex of this tooth, above the apex of this one. So this is firm and this is firm. So, and one more engaging to the above the apex of this lateral incisor. So there is a divergent implants. These are divergent, and while placing it, you just place like this and bend it, and then you place another implant straight into the nasal floor. So you can have a look in the X-ray. There is huge periapical lesion, and there's no alveolar bone in this site. I'll show you in the X-ray. So this is the final outcome, and you can see there is a wire, syncrystallized wire with that. So you can see inside also, inside the crown, there's a gap so that the fitting is proper. So now we can fix this like this. A perfect fitting. We're just going to cement it with the GAC or resin modified GAC. Thank you. Let's discuss some important topics. Why we used 2 implants in this case, and why even the conventional implantology is not possible in this case. So first thing is why we used 2 implants. Though we are not dependent upon osseointegration, the principle is different in basal implantology. We depend on osseo-fixation. So whereas in conventional implants we use the alveolar bone. If there is no alveolar bone, we go for a bone graft, ridge split in the anterior region to have a sufficient amount of bone around the implant. So whereas we have a nasal floor in the just in the tip of the nose, at the tip of the nose. So we have nasal bone, nasal floor bone, which is highly cortical bone, and we use that bone, that is the basal bone or the cortical bone. That is why it is called corticobasal implantology. It is different from conventional implantology. Whereas conventional implants use the alveolar bone, we use the basal bone, which is strong enough to load it immediately. So we have used 2 implants. So the principle is osseo-fixation. When it comes to the fixation, we just screw into the bone. So when there is a derotational forces from the tongue, or when you're speaking, or when you're chewing, there is a derotational forces which is acting upon the implant. So when there is a single tooth replacement with 1 implant, it is always dangerous. Don't do that, don't attempt. So if you place 2 implants, that is well and good to compensate the derotational forces. So what we did in this case, we placed 2 implants, one just in this direction and one straight into the nasal floor. You can see there is no bone in the alveolar part of this. There is huge radiolucency, and there is no enough amount of alveolar bone. So we just used nasal floor above the root apex. Even the bone above the root apex of the adjacent teeth is also a good bone. You can engage it into the basal bone and the nasal floor cortical bone. So we just fixed our screws into the cortical bone, and we can bend these implants. So that is the beauty of it, and we can join these implants with our natural tooth.